What are sexually transmitted diseases? Sexually transmitted diseases, or STDs, are infections that are primarily spread through sexual contact. This contact can include vaginal, anal, and oral sex. STDs are incredibly common, and many people who have them may not even know it due to a lack of noticeable symptoms. These infections are caused by various organisms, including bacteria, viruses, and parasites. It's important to understand that anyone who is sexually active can contract an STD. This is regardless of age, sexual orientation, or gender identity. The good news is that most STDs are treatable, and many are even curable with the right medical attention. Early detection and treatment are crucial to prevent serious health complications that can arise from untreated STDs. These complications can include infertility, certain types of cancer, and an increased risk of contracting HIV. We'll delve deeper into these risks later on. Common sexually transmitted infections. There are many different types of STDs, each with its own set of symptoms and potential complications. Let's take a closer look at some of the most common STDs. Chlamydia. Chlamydia is a bacterial infection that often presents no symptoms. When symptoms do occur, they can include pain during urination and abnormal discharge. Gonorrhea. Another bacterial infection, gonorrhea, can cause similar symptoms to chlamydia. In some cases, it can lead to pelvic inflammatory disease or PID if left untreated. Syphilis. Syphilis is a bacterial infection that progresses through different stages. It can cause sores, rashes, and if left untreated in its later stages, can lead to severe health problems. HIV, or human immunodeficiency virus. HIV attacks the body's immune system. While there's no cure for HIV, with proper medical care, people with HIV can live long and healthy lives. HPV, or human papillomavirus. HPV is a very common viral infection. Some types of HPV can cause genital warts, while others can increase the risk of certain cancers. Herpes. Herpes is a viral infection that causes sores and blisters. There are two main types: HSV-1, which usually causes oral herpes, and HSV-2, which usually causes genital herpes. Hepatitis B and C. Hepatitis B and C are viral infections that affect the liver. They can be spread through sexual contact as well as through contact with infected blood. It's important to remember that many of these infections can be present without any noticeable symptoms, which is why regular testing is so vital. Lesser known but prevalent infections. While the STDs mentioned above are some of the most commonly discussed, it's important to be aware of other infections that can also be transmitted sexually. Two such infections are trichomoniasis and bacterial vaginosis, or BV. Trichomoniasis is caused by a parasite and often presents no symptoms, especially in men. Women with trichomoniasis may experience vaginal itching, burning, and discharge. Bacterial vaginosis, on the other hand, is not always considered an STD but can be associated with sexual activity. It occurs when the natural balance of bacteria in the vagina is disrupted. BV can cause a fishy odor, unusual discharge, and discomfort. These infections, though less widely discussed, can cause discomfort and lead to complications if left untreated. It's crucial to be informed about all potential risks associated with sexual activity. Recognizing the signs symptoms of STDs. One of the most challenging aspects of STDs is that many people don't experience any symptoms, especially in the early stages. However, when symptoms do appear, they can vary greatly depending on the specific infection. Some common symptoms of STDs include painful urination. This can be a sign of chlamydia, gonorrhea, or other infections. Abnormal discharge. Unusual discharge from the vagina, penis, or anus can be a symptom of several STDs. Sores or bumps. Sores, bumps, or blisters around the genitals, anus, or mouth can be a sign of herpes, syphilis, or HPV. Pain during sex. Pain during intercourse can be a symptom of various STDs, including chlamydia, gonorrhea, and herpes. Lower abdominal pain. This can be a sign of pelvic inflammatory disease, or PID, which can be a complication of untreated chlamydia or gonorrhea. If you experience any of these symptoms, it's crucial to seek medical attention immediately. Remember, early detection and treatment are essential in managing STDs effectively. When STDs are left untreated, they can lead to a range of serious health problems. These long-term effects can impact various aspects of a person's well-being, from their reproductive health to their overall physical health. Some of the potential long-term effects of untreated STDs include infertility. STDs like chlamydia and gonorrhea can cause pelvic inflammatory disease, which can damage the reproductive organs and lead to infertility. Pregnancy complications. Untreated STDs during pregnancy can pose risks to both the mother and the baby. These risks include premature birth, low birth weight, and congenital infections. Increased risk of HIV. Having an untreated STD can increase the risk of contracting HIV. Certain types of cancer. Some STDs, such as HPV, are linked to an increased risk of certain cancers, including cervical cancer. Heart disease. Some research suggests a link between untreated STDs and an increased risk of heart disease. It's crucial to remember that early detection and treatment are key to preventing these long-term health consequences. Regular testing can help identify STDs early on, allowing for timely treatment and reducing the risk of complications. Regular STD testing is one of the most important steps you can take to protect your sexual health. Since many STDs don't cause noticeable symptoms, especially in their early stages, regular testing is often the only way to know your status. The frequency with which you should get tested depends on factors such as your age, sexual activity, and risk factors. However, it's generally recommended that sexually active adults get tested for STDs at least once a year. STD testing is a simple and confidential process. You can get tested at your doctor's office, a local health clinic, or even some pharmacies. Don't let fear or stigma prevent you from getting tested. Knowing your status is the first step in taking control of your sexual health. Preventing STDs is crucial for maintaining your sexual health and the health of your partners. While no prevention method is 100% foolproof, there are several effective strategies you can adopt to significantly reduce your risk of contracting or transmitting an STD. One of the most effective ways to prevent STDs is to use condoms consistently and correctly every time you engage in sexual activity. Condoms act as a barrier, preventing the exchange of bodily fluids that can transmit infections. Another important prevention strategy is to limit your number of sexual partners. The more partners you have, the higher your risk of exposure to STDs. Vaccination is also an effective way to protect against certain STDs. Vaccines are available for HPV and hepatitis B. Open and honest communication with your partner or partners is also essential. Talking about your sexual history and getting tested together can help create a safe and healthy sexual environment. Remember, taking proactive steps to prevent STDs is a sign of responsibility and care for yourself and your partner or partners. Unfortunately, there's still a significant amount of stigma surrounding STDs. This stigma can prevent people from talking openly about their sexual health, getting tested, and seeking treatment when needed. Breaking down the stigma surrounding STDs starts with education. It's crucial to have open and honest conversations about sexual health with young people, providing them with accurate information and encouraging them to make responsible choices. We need to create a culture where people feel comfortable discussing their sexual health with their partners, healthcare providers, and even their friends and family. By normalizing conversations about sexual health, we can empower individuals to take control of their well-being and reduce the spread of STDs. While we have discussed the most common STDs, it's important to be aware that other infections can be spread through sexual contact. These include pubic lice, also known as crabs. These tiny insects infest the pubic hair and cause intense itching. Then there's scabies, a skin infestation caused by mites that burrow under the skin, causing intense itching and a rash. These infections, though less common than other STDs, can cause significant discomfort. Treatment is usually straightforward, involving topical medications. Remember, if you suspect you may have any of these infections, it's essential to seek medical attention for proper diagnosis and treatment. If you are experiencing any unusual symptoms or believe you may have been exposed to an STD, it is crucial to seek medical attention immediately. Your doctor can provide testing, diagnosis, and appropriate treatment options. Early detection and treatment are essential in managing STDs effectively and preventing long-term health complications. Remember that most STDs are treatable and many are even curable with the right medical care. Do not hesitate to reach out to your healthcare provider or a trusted medical professional. They are there to support you and provide the information and care you need to prioritize your sexual health. Your health and well-being are paramount. Taking action and seeking help when needed is a sign of strength and responsibility. Your sexual health is an integral part of your overall well-being. By prioritizing your sexual health, You are taking a proactive approach to living a healthier and more fulfilling life. Remember that STDs are common, but most are treatable, and many are curable. Regular testing is crucial for early detection and treatment. Prevention methods like condoms and vaccination can significantly reduce your risk. Open communication with your partner or partners is essential. Seeking medical attention promptly if you have concerns is vital. By staying informed, practicing safe sex, and seeking medical advice when needed, you can take control of your sexual health and enjoy a happy and healthy life.